Hey everyone, so it's a great day. Welcome. Hopefully you'll listen to this whole video. I've got lots of information for you today. I want to talk about chronic pain patterns in the body and why they can be difficult to get rid of without medication. So I've been a massage therapist for over 18 years, and I've done a lot of trial and error, a lot of studying of the body. I'm very geeky about the work that I do. If you work with me, you know this. I'm very intellectual. I study what you come to me with, and I find the roots of what's going on for you so that we can get down to the bottom of things. Tension patterns in the body are usually more complex than they seem. You'll feel pain in a spot or in a muscle or in an area, and so of course logically we think the problem is in that area or in that spot. Right, but what I've found throughout the years with my work is that that spot or that area is actually the outcome of an issue. It is not the cause of the problem, it is the effect of the problem. So the job that I've taken on in my work is to kind of be a spy, look into the tissues of the body, ask my clients, okay, what do you do? Tell me about your postures, and track that tension pattern into all of the other fascia and muscles that are corresponding with that pain spot, right? So mostly there's 4 major areas that people come to me with pain in. The first and most common is the hips and low back. The second most common is the shoulders, upper back and neck. Third is knees. Fourth is feet, ankles, calves. Okay, so I'll probably focus mostly on the back and hip today, but if you have questions, please message me about other areas of the body as well. So when someone comes to me, let's say, we'll talk about Jane. Okay, so Jane comes to me and she's got pain in her lower left back, kind of the top of the hip, bottom of the back. Okay, this is really common. Pain patterns across the top of the hip and up into the lower spine are really, really, really common. Okay, so Jane wants me to work on that spot because she wants relief. She wants me to scratch the itch for her. But because I'm an intellectual and I'm a muscle geek, I come in and I say, okay, that's not the problem, Jane. We've got to search for the tension pattern that's rooting this knot or this tight area, okay? So this is when it's important to talk about connective tissue. So the muscles are not separate from other muscles or separate from the body. Each muscle does its own thing, but they're very codependent with each other, right? They're always communicating, okay, who needs to be working right now? Who needs to be relaxing? What muscles need to support this other muscle? So this happens a lot when we have overuse patterns, right? Like sitting a lot for my active clients, cycling a lot, running a lot, lifting weights a lot. The body gets into these tension patterns, and whatever muscles that you're using have to start leaning on the fascia. So when the muscles start getting really tight, they get tired, they get overused, the fascia is actually there wrapping the muscle fibers, wrapping the muscles, and then wrapping each muscle and connecting it to all of the other muscles throughout the body. It wraps the organs, it wraps everything. So it's kind of like a communication highway. That's how I see fascia. If you have tension, let's say, right here, like in this muscle, quadratus lumborum, because you're on a bike a lot and you're, over the handlebars a lot, and so this is overstretched and used all at the same time, right? So this quadratus lumborum muscle will get tight and it'll start leaning on the fascia that's wrapping it, and then the fascia that connects it to other tissues. So what I usually focus on is 3 areas outside of the point of pain, okay? So if Jane comes to me and she says, okay, it's this spot right here, I'll say, in my mind, I say, okay, what other 3 areas can I look at to find the release points so that this area of tension actually stops hurting her and stops creating pressure, right? So we want to release the torque. I visualize a massive tug of war often when I'm working on people. So, if there's a tug of war going on here, and maybe even at the front of the right leg as well, which is a really common tension pattern that I'll find. If you have pain in the low back, I'll find that these muscles and tissues are sticking together on the outside of the same leg, and then I'll find the front of the opposite leg is doing the same thing. And then this part of the back. So if you can kind of visualize this, there's 3 different areas, and the spot of pain is actually kind of in the middle of those 3 different areas, right? So this is like the weak point. This is the one that's giving in. This is the one where the nerves are tired. They're mad, right? They're getting sensitive and they're giving you a pain response. But it's just giving you a message. It's saying, hey, there's a problem. We have to do something, right? Or we're going to get injured, okay? So in the hips and low back pain pattern, if it's here, I look up. So usually the erectors, meaning, you know, the muscles of the back that keep us erect, those are sticking possibly to the rib cage or some fascia around it, sometimes even the spine. I'll look down into the leg as well, where the IT band is often sticking to the front, the back of the quad, front of IT band, back of quad. I have a great foam rolling post and video on here if you go back a bit, I think a week or so ago. I talked about that quite a bit. So if you're having back pain, you can go down into the side of the same side leg, and even the front of the opposite leg. So this is the right leg, this is the left, the back of the left leg, front of the right. So going to the front of the right and kind of figuring out, okay, if I were going to treat my back, I would go to the corner, the outside corner of this leg, meaning where the front of the leg and the side of the leg meet, right? So I'm going to look for something that's sticking there. And when you go there, when you foam roll for yourself or you use a gua sha, which I've also done a little bit of a video about, a reel about this week, you're going to feel either numbness, which means that this is really old tension, right? And the nerves have kind of lost some of their reactionary ability. They've just been compressed for a long time, and so I find that in really old tension, we'll have decreased sensitivity in the area. For newer tension, more inflamed tension, it'll be more like a, oh, ow, yowza, you know, that really hurts when I put pressure on it. So you'll either find numbness or you'll find kind of a yowzer point, right? But we want to release this tug of war that goes up into the hip, down the back, and then also along the side of the leg. So what happens when the fascia starts sticking, and sticking different muscles together, different tendons and ligaments, bones, muscles, it will stick lots of different things together. I've even found tension on veins, where the vein is sticking to the tissue around it in cases of trauma. You know, when that happens, the muscles that are sticking together, the units that are sticking together, no matter what kind of a tissue they are, they're supposed to be doing different things, right? The quad does something different than the IT band. They overlap, you know, maybe sometimes they help each other out, but when they start sticking together, it's like two fighting siblings, you know, they're pulling each other in different directions, but at the same time trying to do the same movement. So that creates a lot of stress on the joint right here that it's attached to, right? And where does that go into? Where does that translate into? It translates into the lower back. So you'll get a pain pattern here. You know, a lot of people will come to me and they'll say, I have Piriformis Syndrome. Okay, were you diagnosed? No, but, you know, the pain is so terrible that I know it must be like the worst thing that you can get in your hip, which is Piriformis Syndrome, a lot of people think, or sciatica. Okay, also called sciatica. So oftentimes what I'll find is if I release the low back and I release the side of the leg and the anterior hip on the other side, that sciatica relaxes because the fascial sheaths around all the muscles that that tension has translated to are now allowing the piriformis muscle that wraps the sciatic nerve to chill out a little bit, right? So this is a big lesson for people, you know, over all of these years. One of the things that I've seen is people suffering, right? This is one of the most impactful things about doing what I do is people come into my office and they are really suffering. You know, a lot of the people who come to me, because I'm the type of therapist that I am, they're at the end of their rope. They've tried doctors, physical therapists, trainers, chiropractors, and they don't know what else to do. They don't want to take meds, and they don't want to get surgery. So through the grapevine, they'll find out about me and they'll come to my office, and they're just done. You know, they're tired of not finding a solution. So I want to communicate to everyone that there is hope. You know, chronic pain can be emotional. It can be really tiring. We start to have thoughts when we have chronic pain, especially as athletes. or the athletic or active inclined people, we start to think that we're less valid, right? When we have pain patterns that are keeping us from doing what we want to do, our sense of self is diminished because these pain patterns get in the way. So it can be emotional, it can be depressing. A lot of the people who've been in chronic pain over the years that I've seen are literally depressed from it. So I really want to communicate that, pain patterns are not hopeless. It's just that they're more complex than they seem. It's not just pushing on a point to release it. It's not getting somebody to stick their elbow into a knot so that you can feel better. All that does is bring blood flow and tell the nervous system to stop doing what it's doing in that spot. But it doesn't tell everything else that spot is rooted into to stop doing what it's doing, right? We can't just release the spot of pain and expect to be done. We've got to look at the bone structure. We have to look at the fascia. Okay, is there fluid stuck in the connective tissue? Is there fluid stuck in the muscle fibers? All of these things create pressure on the nerves and create a pain response for us. It's giving us a message. Okay, so we can take that message and we can think dynamically about it, right? Instead of saying, okay, I'm going to release this one tension point. I'm going to go find somebody who can just get rid of it. We have to instead discern, okay, what is this connected to? Why has this not released for this person? Again and again, I'll do this when I work with a massage client. I have quite a bit of success with getting people out of pain and out of mobility issues. Being a certified personal trainer as well, I can help activate muscles that have been sleeping as well to interrupt this entire pattern, right? But people who come in for this kind of stuff, if, okay, the first thing that I try doesn't work, all right, we're going to try something else. We're going to keep trying different patterns of release until we get it, because it's there. I've had people come to me after they've had surgery or sometimes multiple surgeries over years, and, they're still in pain and they're still having problems, or they have a secondary issue now because the surgery caused something else. Okay. This is very sad. This, as a healer, this is hard to see. And then I'll give them an exercise, or I'll work on something, and their pain pattern will diminish by 40 to 80%. And they almost want to cry because they got the surgeries, and they wish they hadn't. So I think as we go through treatment, as we go through the process of trying to get rid of our own pain, it's really important to not get hopeless. If a doctor or someone is telling you, okay, this surgery is the only way to heal this, and that is true in some cases. Stenosis is one issue that happens that can be really difficult to get rid of without surgery. Sometimes carpal tunnel, but there's a lot of different things out there, a lot of different ways of thinking. If you come to a therapist like me and I come to the table with curiosity, with an open mind to read your body, that's when we get somewhere. But I would need you to also do the same, to be open to finding a solution, to say, hey, you know what? I'm not going to let this decide my life. I'm not going to let this govern what I can do and what I can't do, right? I am going to find the answer and start being curious. Follow me here. Share this video, please. Like it. I think this is a really important message because there's so many people in physical pain. I'd like to get the message out there. So if you can, share it out, like it, comment, and I'll see you again real soon with another video. Thanks for chiming in.